Thank you everyone for coming for this really important occasion of our clinic, where we've seen 100,000 patients in the last 13 years. And I'm glad that all of you could take some time off your busy morning schedule on a weekday, work day, and join us, brave the traffic. And it's nice to see all of you. I see that this is really, a big honor for us. Can you all hear me? Yes. All right. So, I just want to recognize our distinguished guests, Collin County Judge itself, CFO of Capital One, Mr. Bachani, Girish Bachani, Line International District 2X1, Governor Bill Smotherman, and also Governor from 2E2 Club, Tom Hayford. Thanks. I was looking for Paul Pandian. I thought he was going to be here today. Anyway, I want to mention Paul and Satish Gupta, and also Vinay Jain, Dr. Vinay Jain, who is our with the Jeevdaya Foundation, who has been. These are three people who have been backing our clinic in a big way, and I want to recognize they're not able to come today, but maybe they'll be later. They'll be here later. I would like to briefly go over our clinic history. The clinic was started in 2003 by the Irving DFW Indian Lions Club. We had around that time about $25,000 in our charity fund, and we were looking for a service project that we could start right here to make a difference in the lives of people in the local community. And up to that time, we had sent money to various charities that we really did not have a lot of control over. So I volunteered to be the medical director, and we started this clinic in Lewisville one day a week on a Saturday morning. And I think we saw about 20 to 25 patients. And for a whole year, we continued this schedule, and we thought maybe we could improve on that, and the demand was there. So we started, we essentially hired a doctor full-time to see the patients in a different location in Lewisville, and we are now open 6 days a week. And in 2007, I think we moved to Plano, and that's where we started our second clinic. And it was at a different location. This is the second location in Plano. The other, we moved from that previous location, and there were again, a lot more. There was a lot more demand for the services, and then we opened our clinic in Dallas in 2012. So these are originally intended, or this clinic was originally intended for people without insurance. But times have changed, and I think there are many more people who are now seeking our help who have insurance. So we now see about 14,000 patients a year in all the three clinics. And in the last week of May of this year, 2016, we crossed our 100,000th mark. Our clinic is very unique in how it is sustained. It is a public-private partnership, but the public here is not the government. Public here is represented by all of our patients, and some of you are here representing patients, the patients. Fixed fees collected from the patients covers about 70% of our operating expense. Private donations from individuals and corporations covers the remaining 30%. And to date, we have not received any money from federal, state, county, or city government. We are hopeful that our present model of clinic operation is very sustainable. We are happy to be able to meet our goal of providing easy access to quality medical care, mainly primary care, at an affordable cost. And surely there is plenty of scope for improvement, and we would like to do more things, including some outreach for especially diabetes diagnosis and treatment. A modest estimate of the value of services provided through our clinics is in excess of $2.5 million. many of you may be wondering if these clinics are needed after the passage and implementation of the ACA in 2010. Unfortunately, the need for affordable primary care has only increased. Today, many more people are insured, but they have less access to come to our clinics, mainly go to their primary care doctors because of narrow networks of providers and high deductibles and high co-pays. Our clinics are seeing many uninsured patients and many underinsured patients. Also, many undocumented persons come to us for their health care. And I know between Dallas, Tarrant, Collin, and Denton counties, 30% of all undocumented persons in the state of Texas, they live here in these 4 counties. And that's about 300,000, a little over 300,000 of the 1.5 million. And they are mostly without insurance, so their health care, somebody has to meet it, and we are happy to do that. I want to recognize and thank the volunteer board of the board of directors of our clinic. They have worked hard to keep the clinic doors open. Peter Netto, you may have seen him here.
Yes,
he is our most valuable and most important person in the board. And I also want to acknowledge the contributions of Dr. Geeta Pandian and Lions Joe Montag, John Joy, A.P. Haridas, A.K. Mago, Mahesh Patel, and Andrew Thomas. And I want to express my deep gratitude for allowing me to do this work as a volunteer medical director. I think it's a lot of challenge, but I'm enjoying it, and I'm happy to do it, and then God willing, maybe for many more years.
Amen.
And I also want to recognize the great work and good work that is being done by our medical doctors and nurse practitioners. Kirit Solanki is here, Ruby John, Sheila Matthews. I see Dr. Bal Khandelwal, he's a volunteer for the last 1 year. He's been seeing arthritis patients in our clinic every Thursday. So I think that's their work that allows us to do what we do. Anyone who has volunteered knows that it brings them much happiness, and that's why I guess most of us here who are volunteers in some way or another like to do that. Our spouses and children, on the other hand, make big sacrifices. And I know we get to hear that all the time. But it's nice, and I really think they allow us the time we need to do this work, and I know a good bit of quality family time that we have to move away from and do our volunteer work. And I want to express my sincere thanks to all volunteer spouses for their goodwill and their support. And many thanks to my wife Sheila and Peter's wife Dimfna for their patience and understanding.
What about my wife?
She is here. I think that's about all I have, for my comments. I want to introduce now our chief guest and County Judge Keith Self. Judge Keith Self is the presiding officer of the Collin County Commissioner's Court, and for many of you who are not familiar with that position, he's like the mayor to the county. I know, because I didn't know exactly what the role of the county judge was, and I think it's a very important position. With about 1 million people in the county, this is the 7th largest county in the state of Texas by population, and it's anticipated that they will grow into 2 million by 2030. And we are growing fast. I've lived here in this county since '87. And he's a 5th generation Texan who brings 25 years of distinguished career experience as a U.S. Army officer to his current position. He is a 1975 graduate of U.S. Military Academy at West Point. Collin County is really lucky to have someone who has dedicated the rest of his life, I would believe, to civil service and knows the importance of healthcare for the most vulnerable in our county. And please welcome him.
Thank you so much, Dr. Joseph. Healthcare is important, and I will tell you in the military, one of the key changes that we have seen over my career in the infantry is how far forward we have pushed medical care in the combat zones. We don't talk about the golden hour anymore. We talk about the golden 30 minutes, and it has just been amazing what we have done in the military. It's a delight to be here today. We could talk about the accomplishments of this place. You know it well if you've been here, if you've heard 100,000 patient visits, 13 years. That in itself is quite an accomplishment. It really is. 14,000 visits a year now, 3 counties that they cover. It's just wonderful what they have accomplished. But I want to focus today on the model, because I think they have hit on what we need to be expanding in our country today, and that is this model of a community in your church, in your civic group, as in a Lions Club or a Rotary Club, a community banding together to start to help their fellow man. I think that government has taken too many of the charitable functions in this nation, and I think we need to return to this model. So I want to congratulate Dr. Joseph on leading the way as not only the executive director of this organization, but for 13 years of volunteering, because that word is the key here. Volunteers, from the head man right on down, from the board to the executive director right on down. That's the way we ought to be thinking about this. And as he mentioned, this ACA has really not done much to solve the problems of healthcare in America today. So this model is going to become increasingly important. So while I do congratulate you on all of your numbers, I believe you hit on something that's far more important and that we need to be exporting to other places. And that is the model that you have established here of a volunteer board banding together to find the resources, both for the volunteer doctors, the nurses, probably the equipment, and now they've added an important partner in Capital One. And I just appreciate the way, absolutely. I have appreciated for several years now the way that Capital One has come into the community and has made a difference. And I appreciate that. And all of the Capital One employees that are here, I appreciate it. I thank you for your support. It will be important to this organization and I know others. So today I just ask you to think about the model here. Beyond just the success story, this is what we need to be about. Thank you for having me today, and I appreciate you being here to help us celebrate.
Thank you, Judge Keith, and